Gentlemen, let's have a straight up, honest conversation. Have you ever had an erection that just didn't last the way you wanted? Or worse, have you ever felt that sinking feeling when things fizzle out right in the middle of intimacy? It is frustrating, it is embarrassing, and if we're being completely transparent, it eats away at your confidence as a man. It makes you feel like you're losing a part of yourself. But what if I told you the answer to reclaiming that strength might not be a blue pill, an expensive supplement, or some high-tech gadget? What if the key was a simple 5-minute exercise that you can do anywhere, at any time, without anyone even knowing you're doing it? We are talking about an exercise proven by clinical science to restore stronger, longer-lasting erections while simultaneously helping with bladder control, stamina, and even chronic lower back pain. Stay with me, because today I am going to walk you through the exact step-by-step way to perform this routine. I'm also going to reveal the number one mistake that almost every man makes, a mistake that actually weakens your performance instead of improving it. Before we dive into the how, do me a quick favor. Pause this video for just 2 seconds. Hit that like button and subscribe if you're new to the channel. And I really want to know, where are you watching from today? Drop your city or country in the comments. I love seeing this community of men from all over the world coming together to prioritize their health. You've probably heard of Kegel exercises before. Most men hear that word and immediately think of something women do after childbirth. Here is the myth-busting truth. Your pelvic floor muscles are the literal foundation of your masculinity. These are the muscles that hold up your bladder, support your prostate, and most importantly, control the valves that trap blood inside your penis to maintain an erection. The problem? Most men are either ignoring these muscles entirely, or they are doing the exercises completely wrong by focusing only on squeezing harder. That can actually backfire. Your pelvic floor needs a specific balance of strength and flexibility. If it's too weak, you leak blood out of the penis and struggle to stay firm. But if it's too tight or hypertonic, you actually strangle your own blood flow. Real, lasting results don't come from clenching as hard as you can. They come from balance. If this is your first time here, hi, I'm Dr. Jocelyn. I'm a urologist, and for the last 5 years, I've dedicated my practice to helping men reclaim their confidence, improve their performance, and protect their prostate health. Over the years, I've guided thousands of men, fathers, grandfathers, professionals, and athletes through programs designed to rebuild their pelvic floor. I've seen firsthand how life-changing these results can be. Consider a study published in the Journal of Sexual Medicine. They followed a group of men struggling with erectile dysfunction who performed consistent pelvic floor training for 6 months. The results were staggering. Nearly 40% regained completely normal function, and another 35% saw massive improvements. That is over 70% of men getting their groove back without a single prescription pill. That is the power of biology when you give it the right stimulus. Before I show you the routine, we have to address the sabotage factors. If you make these 3 mistakes, you're basically spinning your wheels. Mistake number 3, training only for strength. Most men hear about Kegels and they start clenching all day long. But think about your bicep for a second. What would happen if you flexed your arm as hard as you could and never let go, never stretched, and never relaxed? Your arm would get stiff, painful, and eventually the muscle would actually get weaker because it can't move through a full range of motion. The biology: if you only focus on the squeeze, your pelvic floor becomes hypertonic. This creates a choke point for the very arteries that need to deliver blood to your penis. The emotional impact: it leaves you feeling locked up and frustrated because you're putting in the effort, but your erections feel shallow or cut off. The practice: you have to learn to let go just as well as you learn to squeeze. Mistake number 2, engaging the wrong muscles. How do you know you're actually hitting the target? I see so many men accidentally tensing their abs, their inner thighs, or their glutes. The biology: those are compensatory muscles. If you're using your abs, you aren't isolating the bulbospongiosus muscle. This is the specific muscle that wraps around the base of the penis. It's the one responsible for that bounce you see when you're erect. The practice: if you aren't isolating that specific muscle, you aren't training the gatekeeper of your blood flow. It's like trying to fix a leaky faucet by painting the kitchen. It looks like work, but the problem remains. Mistake number 1, ignoring relaxation and stretching. This is the critical error. Almost no one talks about stretching the pelvic floor. The biology: without relaxation, the pelvic muscles can't fully expand to let the maximum volume of blood in during arousal. If the muscle is always half clenched, there's no room for growth. The emotional impact. This leads to erections that feel thin or short-lived, which can cause significant performance anxiety. The practice. The winning formula is strength plus flexibility plus relaxation. That is the trifecta that rebuilds healthy function. All right, let's get to work. This is the routine I prescribe to my patients. You can do this while driving, sitting at your desk, or lying in bed. Step number 1. Identify the target 30 seconds. To find the right muscle, next time you go to the bathroom, try to stop your urine stream mid-flow for just 1 second, or imagine you are trying to hold in gas in a crowded room. That lifting and drawing up sensation, that is your pelvic floor. Note, don't make a habit of stopping your urine. Just do it once to locate the muscle. Step number 2, the strength phase, 2 minutes. Contract those muscles for 3 to 5 seconds. Relax completely for 5 seconds. The relaxation is just as important. Repeat for 10 reps. As you get stronger, work up to 10-second holds for 3 sets daily. Step number 3, the flexibility phase, 2 minutes. After the strength work, you must lengthen the muscle. Choose one of these two. The deep squat. Stand with your feet wider than your hips. Sink down into a deep catcher squat. Use your elbows to gently press your knees outward. Breathe deeply into your belly. This naturally drops and stretches the pelvic floor. Happy baby pose. Lie on your back. Bring your knees to your chest and grab the outside of your feet. Let your knees fall wide and breathe. Step number 4, the nervous system reset, 1 minute. Finish with 1 minute of slow, diaphragmatic belly breathing. Inhale through the nose, making your stomach expand, and exhale through the mouth. This signals your nervous system to move from fight or flight into rest and digest, allowing the pelvic muscles to return to their optimal baseline. I want to pause here and tell you something very important. If you've been struggling, if you've felt that sinking embarrassment, I want you to know you are not broken. This is not a sign that you've lost your manhood. It is simply a sign that a specific part of your body needs care and retraining. The best part about this approach is that unlike a pill, which just masks the symptoms for a few hours, this addresses the root cause. You are rebuilding your body's actual ability to function. That is where true dignity and confidence come from. Gentlemen, 5 minutes a day, that is all it takes. Strength plus stretch plus breath. Don't wait for things to get worse before you take action. Start tonight. Consistency is your best medicine. If you do this for 8 to 12 weeks, the version of you that looks back from the mirror will be a much more confident, capable man. If you found this video helpful, please hit that like button and share this with a friend who might be struggling in silence. Sometimes a simple video is all it takes to change someone's life. And make sure you're subscribed so you never miss these sessions. Remember this, age is not a thief. It does not have to steal your vitality. With the right habits and a little bit of discipline, your best days of strength, intimacy, and confidence are still ahead of you. I'm Dr. Jocelyn. Thank you for spending these 5 minutes with me. Take care of yourself because you are worth the effort. I'll see you in the next video.